OSCE is an approach to the assessment of clinical competence in which the components are assessed in a well planned or structured way with attention being paid to the objectivity of the examination.
Before starting, the candidates are given 15 minutes cool off time. During this time, various instructions regarding the exam are given by the examiner.
OSCE examination consists of 10 to 15 stations which require about 4 to 5 minutes. The number of stations and time spent on each station may vary based on the need of evaluation. In this OSCE for nursing management, we have arranged 2 stations and for each station the students are given 5 minutes.
After the guidelines being given, the students will move to the interpretive and procedure station. Each station is allocated with 5 minutes duration. After 5 minutes, they should move to the other stations. After completion of the exam, the examiners will assemble and evaluate the performance, followed by giving the feedbacks to the students. The feedback is given individually. Later, the group is given feedback as a whole along with their performance evaluation. Practicing OSCE and preparing students for real-life scenarios in clinical setting is an effective method for increasing competence and skill.